It's Steven with Real World Nursing, and today we're going to be talking about syphilis, so let's get started. Now real quick, syphilis is a sexually transmitted disease. It's a bacterial infection with a corkscrew shape called a spirochete, allowing it to quickly navigate fluids. In the video, the wood has a similar shape, allowing it to flow upstream. It's a pretty good heuristic into understanding how the bacteria moves. It's on the rise across all groups of people. If you're concerned, always refrain from sex until tested. The transmission is direct contact, like needle sharing and sexual intimacy. Lambskin condoms have pores that allow bacteria and viruses to pass through, so wearing latex condoms can prevent this disease. It's congenital, meaning women can pass it to their baby in the womb or direct contact with lesions during birth. Diagnostics involve lab draws for antibodies. The prognosis is great with treatment. Now, any nurse must report these cases to authority. It's a nationally reportable disease per CDC, but specifically, the NCLEX wants to know about abuse, like a school nurse finding it on a kid, or a geriatric nurse finding it on grandma. Agencies you can call include Child Protective Services, Adult Protective Services. Reach out to your local health department for guidance. There's a list of phone numbers at the end of the video any real-world nurse needs. Shifting focus, the Tuskegee Experiment, led by the U.S. Health Public Services, had doctors and a nurse experimenting on black men who already had syphilis. Their treatment was withheld from them so the effects of the disease could be studied. No doctors or nurses lost their license for this tragedy. The first stage, or primary syphilis, starts about 3 weeks after being infected. The first sign is a painless, hard-based chancre with an open lesion at the center leaking highly infectious fluid. This marks the beginning of the disease. Often going unnoticed, many women are unaware of them due to the locations on their cervix. Men can get them inside the urethra where it isn't even visible. I chose to keep one on the tongue for the video to keep everything PG, but you could just imagine all the different places it can appear. They resolve regardless of treatment, but treatment prevents progression into the next stages. The next stage is secondary syphilis, occurring about 2 months after the initial stage. Bacteria presents differently now with body-wide rashes, palpable swollen lymph nodes, fatigue, and oral sores. The hallmark symptom being rashes on the soles of the feet and palms of the hand. This is a key differential between typhus, which is a different disease that causes rashes but spares these areas. About 50% of these patients don't even recall the first stage. This stage will resolve in about 3 months with or without treatment. Patients then enter a latent period, when the bacteria is dormant but lab tests are still positive. After about a year, they're no longer traditionally infective. This stage can last indefinitely. The third stage, or tertiary syphilis, is the final stage, happening anywhere from 30 to 30 plus years after the latent period in about 15% of untreated cases. It involves severe complications, damage to the liver, heart, brain, nerves, or eyes. Lesions in the heart cause cardiovascular syphilis, in the brain, neurosyphilis, in the eyes, ocular syphilis. It mimics so many other different diseases, giving it the nickname the Great Imitator. Neurosyphilis, the most well-known common complication, affects our core personality, including beliefs and emotions. It's been known to radically change people's perceptions. These patients often have delayed speech, terrible lymph node hardening, difficulty walking, memory loss, and confusion. These lesions in the brain can affect anything, and depending on where they are, determines what's going to be affected. Roughly 20% of patients in a sane asylum had neurosyphilis. Ocular syphilis, the lesions typically cause vision loss, usually an abnormality in pupil constriction called prostitute's pupil. The medical name is Argyll-Robinson's pupil. They do not react to bright lights when shined, but constrict when accommodating to a near object. There's a brief video showcasing the phenomenon. For teratogenic effects, it's critical to understand during the first and second stage it crosses the placenta and can cause fetal death in pregnancy, so treatment is mission critical. This is why routine testing is common in pregnancy. During the latent period and the third stage, these effects usually range from mental disability to deformed teeth to vision loss. Now, as far as holistic treatments go, you're going to need a doctor. Essential oils can't cure this disease. Historically, topical mercury was used. For pharmaceutical, the gold standard is Penicillin G, usually given IM in a single injection up to 3 times. I've seen it be given IV piggyback over a couple days. If they have a penicillin allergy, desensitizing their allergy is key for treatment. Even if you get treated, you can get it right back if you're not careful. You're going to need to know, when syphilis is destroyed, a poison is released from the bacteria causing a reaction named JHR. It's temporary and the symptoms subside in about 12 hours. The reaction is not a reason to stop the treatment. This also occurs in Lyme disease. It's similar to how other bacteria release endotoxins when the patient gets treated with antibiotics. Well, there you have it, the real world guide to syphilis. Do this, like and subscribe, or your teacher's going to assign a 100-question test with remediation. I'd be clicking those buttons because I'm not going through those again.